Hello, South Florida and beyond, and welcome to the show. We're here with Dr. Michael Kinya. He's an orthopedic surgeon and sports medicine specialist with Tenet Florida Physician Services. Dr. Kinya, how are you doing this afternoon?
I'm doing well. Thanks for having me.
And thanks for joining us. I always say this on this adventure of health because we always learn so much from our providers. So times are, have definitely changed. What are some of the most common injuries you're currently seeing patients and providing treatment for during this COVID-19 pandemic?
So we're seeing a lot different injuries than we were seeing before, with sports being canceled, with gyms being closed. We're not seeing those sort of injuries that we saw. We're seeing a lot of lower energy injuries than we saw before. A lot of parents are getting out there with their kids a little bit more and getting injured occasionally when they do so.
Yeah, so a lot of different things, a lot more walking, a lot more running in the neighborhood. I guess bicycling as well. That's a big one. I don't think I did much bicycling at all before this pandemic, at least not in the last 10 years. Are you seeing those types of injuries as well? Maybe things that have, people overdoing it on their bike or running or even walking, because I can tell a little quick story. When I started walking during the pandemic, I was lifting weights as I was walking, and I strained my shoulder. I almost had to give you a call, but it went away after like about a week of suffering from it. So are you seeing those types of injuries as well?
I think bicycles are probably the biggest increase that I've seen since this all started. A lot of people are just having little injuries where they're falling off their bikes. We had a patient today who got their bike caught on something and injured themselves. A lot of wrist injuries and elbow injuries are resulting from that. And we are seeing a lot of injuries, overuse or repetitive use injuries from people who are out there running and walking when they weren't doing so before.
I found it interesting when we talked a little bit before this interview. You said a lot of what you did were, serious, or what you provided care for were more serious injuries like car accidents. So with, people not traveling in the car as much, I guess it's starting to happen now. People are starting to get back a little more into their normal routine. But I didn't think about that. But orthopedic surgeons treat a lot of, serious, accidents or injuries, I should say, from like car accidents and trauma, correct?
Correct. That's one of the biggest causes, one of the most common injuries in a car accident or orthopedic injuries. A lot of fractures result from it. We haven't been seeing the numbers of motorcycle collisions or car accidents that we had been seeing prior, and that's maybe one good thing that's come out of this, is that people aren't getting into these sort of accidents and having the high level traumas that they were before. It's also allowed our ICUs to have more COVID patients and more capacity for that, and that's been a good thing as well.
And you mentioned overuse and chronic injuries. Let's start with overuse injuries because obviously, with gyms and sports seasons canceled, for some time, people are obviously doing things in repetition, maybe doing the same thing over and over. One thing a gym gives you is the opportunity to do different exercises. So what are some of the common ailments you're seeing from overuse injuries? And then what are some things that people can do to kind of, I guess, mix it up a little bit?
Well, we're not seeing maybe as many overuse injuries just yet because people haven't had long enough to do a lot of those things. A lot of the injuries that we are seeing are things like ankle sprains while playing with your kids or falling off of a bike. People have been doing a little bit more home improvement and been having some shoulder injuries as a result of that as well. In terms of exercising, I know I've been there. We're all going through exercise fitness apps and doing things on our own that we have around the house. I know for a while I was working out with paint cans and everything just to get a little bit of weight training, resistance exercising. It's just about varying the intensity of the workout, varying the weight, and varying the exercises that you're doing. There are a lot of great fitness apps that are out there, and a lot of them have been offered for free during this pandemic. And they offer a great deal and a wide spectrum of exercises that people can do from home, even without much gym equipment.
Now, if someone has a smaller injury and they leave it untreated, maybe for whatever reason, maybe they, still have a little bit of fear of, going into the hospital or the doctor's office, which we're going to talk about safety protocols in a little bit here. But if a smaller injury is left untreated, what are some of the ways it can become a bigger problem?
So, by and large, the vast number of injuries that occur in doing something like running get better on their own. Even if they start out as something big, over the next several weeks, they tend to get better on their own. There are certain injuries, for example, a shoulder injury, where someone has a shoulder strain and then they start carrying their shoulder in a little different way in order to decrease the shoulder pain that they are experiencing. They can start to recruit other muscles in a very unhealthy way. So their shoulder motion changes, and it actually, pain begets more pain because then they start to use muscles to move their shoulder where they weren't designed to do that. And people develop some chronic injuries, a lot of neck pain, and other things like that because of it. And if they just seen a doctor earlier in it, we could have instituted some changes very quickly that would have mitigated those.
When should someone, go to the hospital? When should they, call a doctor's office? What's the criteria, you think for, those types of injuries?
It's hard to say without an exact type of injury. Most of the time, if it's something that's not too bothersome for a person, I like to tell them to wait, 1 week at least, and take some time off from the activity that's offending, take some over-the-counter medicines, whether it be a Motrin, a Aleve, a Tylenol, try some ice, try some heat to the area, and just give it a rest. If it's something more severe, then yes, I do want to see people either in the hospital, in an urgent care clinic, or in my clinic a lot faster, because if it's something that's severe that's causing a great deal of pain, there's likely something going on that needs to be diagnosed quickly.
Now, let's talk a little bit about your clinic, your office. Obviously, it's open and safe. You have two offices, one in Fort Lauderdale and one in Boca Raton. Talk a little bit about the safety protocols at your office.
So I think from the second people step in, they'll notice a difference if they were there before. That we do have some clear partitions that are up in front of our staff at the beginning. Before the patient even comes in, we're doing excess cleaning before, during, and after patients are seen during the day. Everyone is required to wear a mask when they come in. They'll notice a lot of the chairs in the waiting room have tape over them to be blocked off so people are socially distancing within the office itself, especially in the waiting room. We have doubled the number of hand sanitizer stations within our office too, both with formal stations and also just with hand sanitizer sitting around the office, so it's always available to patients and providers. We are limiting the number of people in our small offices and examination rooms to hopefully just the patient. But if the patient is a minor or needs someone to help translate or has some cognitive disability that they need someone to help interpret things for them, they are more than welcome and invited into the room. But we're trying to minimize contact between providers and patients. For me, it was hard at the beginning not to shake people's hands, but now we're doing a lot more elbow bumps and things like that in order to know, still maintain a level of socialization without touching hands.
Yeah, I think everyone's done a good job with that. I mean, it was hard at first. We're so used to, set in our ways. And, now even wearing a mask in public isn't even that big of a deal. But I remember, when we first put it on and, you were first saying hello to someone and meeting them and you're like, oh, let me give you the elbow. So, yeah, things have definitely changed, but changed as well in the office. Let me give out some information on your office. Again, it's Dr. Michael Kinya. The website is drmichaelkinya.com. So it's Dr. Michael Kinya, KINDYA.com. Two offices, one in Fort Lauderdale, and the location of that office, beautiful office, 2307 West Broward Boulevard, Suite 200 in Fort Lauderdale. Number there is 954-486-4045. And then also another great office, beautiful brand new office in Boca Raton, 9970 Central Park Boulevard North, Suite 400A, on the campus of West Boca Medical Center. The number there is 561-430-4610. But like I said, you can go to drmichaelkenya.com. All the info there is there as well. Let's kind of switch it over a little bit and talk a little bit about the safety protocol at the hospitals. So obviously, elective surgeries have started back up, and that's orthopedic surgery and the sports medicine care that you provide. So, what are some of the safety protocols at the hospitals in place? Let's start with if someone had seen you, they obviously have a fracture, etc., and need surgery. What are the protocols in place?
So the protocols from the hospital are even more stringent than the office. Um, if someone is going to have an elective procedure, they are seen a day or two beforehand and they undergo not one, but two COVID tests. The first one is a rapid test that we can get back, usually about 30 minutes to 3 hours later. And then we also do the traditional 3-day test to get a final answer as to whether someone has COVID or not. So we're doing two tests. If they test negative for COVID, they're allowed to proceed with an elective surgery. From the minute they hit the hospital, they'll notice increased protocols everywhere. That everyone who comes into the hospital has their temperature checked, and then clean hands right away. Masks are required again at all times. We are separating patients whether they test COVID positive or COVID negative, so there is a small wing for people who are COVID positive. And during the course of the time in the operating room, those patients never cross paths. That all COVID negative patients have been tested and they are held together in the same area. We've been minimizing transfers of patients. We used to have a suite that people would come to before the surgery and then a different suite for after the surgery. We've now merged those into one so that patients aren't going to too many locations at a time.
Very smart. And the hospital you're on staff at, Florida Medical Center, a campus of North Shore in Fort Lauderdale. So great safety protocols in place there as well. Um, I want to talk. You have a long list of areas of interest, obviously, as an orthopedic surgeon and sports medicine specialist. We were kind of going back and forth, but let's talk a little bit more about ankle sprains because those are something that you don't really know when you should see a doctor, but I realize that sometimes, ankle injuries can turn into, a bigger injury with ligaments, etc. Talk a little bit about, ankle sprains.
So ankle sprains are generally when people have them is when someone rolls their ankle or their ankle goes in and the foot goes in and the ankle goes out. The vast majority of these are lower energy injuries, but they can be a result of a higher energy injury as well. And I think most of us have had an ankle sprain at some point in our lives, and they do span a large spectrum. There's a time where you kind of just roll your ankle quickly, you hop around for a little bit, and then you're able to put weight on it. And the next day, after putting a little bit of ice on it and taking some medicine, it is feeling better. And that's the lowest of the grades of injuries. The other ankle sprains that we see are of higher energy and higher injury, and they can result in great amount of swelling about the ankle, even bruising that goes on. Um, and these are partial tears to near complete tears of the ligaments about the ankle. The lower grade injuries are basically sprains or lower grade tearing, partial tearing about the ankle. Treatment usually
Now,
for the is non-operative in nature, which is a great thing for people. But it does require some time, either in some form of immobilization. We usually use a boot, which is similar to a ski boot, that people can generally walk on. We do like to elevate it and get the swelling down with some ice. And after that, when pain comes under control a little bit better, physical therapy has actually been shown to be very helpful for decreasing the risk of subsequent ankle injuries or subsequent ankle sprains after a first ankle sprain.
and then in terms of, so obviously ankle sprain, has its set of standards for orthopedic care. But what are the signs of an ankle fracture? I mean, obviously, when you have a fracture, you're going to be in a ton of pain, etc. But are there some other signs? And when you do suspect you have a fracture, should you see a doctor immediately or an orthopedic surgeon and sports medicine specialist like yourself?
Yes, these are very difficult injuries to tell between high-grade ankle sprains as well. They have very similar characteristics with very early swelling and a great deal of pain. The biggest difference is with an ankle fracture, the vast majority of people have trouble putting any weight whatsoever on the ankle. It's so painful that people are not able to weight bear on it. Um, it's very hard for someone to tell, but there's tenderness over the bone, specifically with an ankle fracture. But with an ankle sprain, it should be just off the bone. But that's a very hard thing for someone to determine. If there's a suspicion of an injury, which would either be of a fracture or a high grade ankle sprain, that should be evaluated whether it's in an emergency department, in an urgent care center, or in an orthopedic surgeon's office pretty quickly. We do get x-rays very, very quickly on these to determine if there is a fracture, if there's just a sprain, and treatment is dictated by the results of that.
Again, we're here with Dr. Michael Kinya, orthopedic surgeon and sports medicine specialist, Tenant Florida Physician Services. Website is drmichaelkinya.com. It's drmichael, KINDYA.com. Offices in Fort Lauderdale and Boca Raton, and he's on staff at Florida Medical Center Florida Medical Center campus of North Shore, I should say, in Fort Lauderdale. Let's talk a little bit about some of the more common tendon and ligament injuries you provide treatment for. So this could, I guess, could not only be in the ankle, but there's ligaments in other portions of the body as well. Tell us a little bit about ligament and tendon injuries.
So the difference between a tendon and a ligament is a tendon is a connection between a muscle and a bone, and a ligament connects a bone to a bone. The most common tendon injuries that I see are generally rotator cuff tears. They're very, very common, especially as we age and get some wear and tear on our shoulders. They're very common after accidents as well. Other things, other tendons that we take care of include bicep tears, tricep tears, which are a lot of times lifting accidents in people who are in the 40-year-old age group. We also see a lot of injuries of different tendons in the legs as well, and whether that's an Achilles tendon rupture, which is very common in basketball players, or quadriceps tendon tears or patellar tendon tears, which are tears surrounding the kneecap, which are also common with falls or accidents.
When do you have to have surgery for a tendon tear? I mean, can some of them be managed, with non-surgical care, or do they have to be managed with surgery?
So it depends on which tendon is torn. Tendons of the rotator cuff can be managed without surgery. They're unlikely to heal, but a lot of times that's of no consequence because people can maintain their level of function just by utilizing other muscles around the shoulder. For some of the other tears, especially about the knee, including the quadriceps tendon and the patellar tendon, those almost always require surgery for full tears. Without that, it's unlikely to heal, and people have a lot of weakness with extending their knee, and that leads to issues with walking and just normal daily life. There have been some new studies out in the past 5 or 10 years, especially out of Europe, that are looking at treating Achilles tendons without any sort of surgery. And they've actually had great results with doing it. But again, you have to be seen right away and be deemed a candidate for it. Still, the vast majority of people in this country have surgery for Achilles tendon ruptures.
Great information. We're here with Dr. Michael Kinya. You mentioned knees. So, what are some of the more common knee injuries you provide treatment for? You see in your office or at the hospital?
So the most common thing we see about knees is generally knee arthritis. The second most common are meniscal tears. So the meniscus is basically, if I were to give it to you, it would feel like a piece of rubber that fits between the bones of the knee. It acts as a shock absorber and reducing the stress, so you're not having bones hitting bones, you're having a cushion there. A lot of times with sporting injuries, running injuries, gym accidents, even simple twisting injuries, you can sustain a meniscal tear. The other things that we see very commonly are tears about some of the ligaments of the knee. The most common one that we hear about are ACL tendon injuries, and we hear about that in sporting athletes all the time. We also hear about other tendon or other ligament injuries about the knee, including the medial ligament, the MCL, the PCL, or even some of the ligaments on the outside of the knee. And I do provide care for all of those as well.
So also, is there a non-surgical, option and a surgical option? Because I've read before. I haven't luckily had a knee injury, but I've read, or heard from people that may have had a, ligament tear for any period of time, and it's not like they had surgery right away, but there was like some unstableness, and then eventually they had surgery. So, is there a non-surgical and surgical, care available for that, or does it always turn into surgery?
So there are both surgical and non-surgical reasons or indications for different treatments. For meniscal tears, if someone has some arthritis present, it's generally considered appropriate to treat that person with non-operative modalities first. There are certain tears of the meniscus where it actually prevents people from bending their knee or extending their knee all the way, and those generally do lead to a surgical treatment. In terms of ACL tears, if someone's young, we generally do perform surgery on those patients. If someone's a little bit older, then we can trial some conservative management, trial some bracing, and see how they do. The vast majority of tears of the medial collateral ligament or the MCL of the knee, we do try to treat non-operatively at first. But a few people do go on to have surgical intervention for that as well. And most PCL tears or posterior cruciate ligament tears are treated conservatively at first, and only after months of failed non-operative intervention do we consider surgery for them.
Well, it's great to have options, non-surgical and surgical options as well. We talk a lot about on these shows with doctors. They have tools, a lot of tools in their toolbox to fix the problem. That's kind
Right?
of the way.
I'll tell my patients I have a surgery for everything. For every problem, there's something that we can do surgically, but for the vast majority of people, conservative care is the right thing to do.
Yeah, I agree. And again, it's Dr. Michael Kenya, orthopedic surgeon and sports medicine specialist, Tenant Florida Physician Services. Website is drmichaelkenya.com. That's Dr. Michael, KINDYA.com. Offices in Boca Raton and Fort Lauderdale. And then on staff at Florida Medical Center at campus North Shore in Fort Lauderdale. Let's continue with the knee. This is a question I was really interested in getting to because I feel like this is something more in the new type of care that's available. Cartilage restoration. Now, is that just for knee cartilage, and what actually is cartilage restoration?
So it's not just for the knee, it's performed in multiple areas of the body, shoulders, ankles, elbows, hips. We can perform that surgery everywhere, but the most common place to have it performed is the knee. So the cartilage, what it is that white end of a chicken bone that you have, and it provides a frictionless motion of our joints, so there's no creaking, there's no popping, there's no clicking. When people start to develop arthritis, it's a wearing down of the cartilage where it becomes a little rough, and that's when people describe some aching or cracking or stiffness about their joints. If someone has arthritis, a cartilage restoration procedure generally is not the right thing for them. Generally, we can perform a cartilage restoration procedure on a small area that's missing cartilage. And what that involves is whether it can involve a few different things. It can involve moving cartilage from a healthy area to an unhealthy area. So taking it away from a place that it's not needed as much and moving it to a place that is more needed. There are some newer products out there that are either cadaver-based products or even injectable products that have some good functional outcomes and have been shown to restore some cartilage as well, that I've been using as well.
That's really neat. Cartilage restoration. That's another area of interest that Dr. Michael Kenya specializes in. And yeah, we're going to wrap it up, I guess, with shoulder. So shoulder injuries. Yeah, there's a lot going on there. Talk about a little bit about the different types of shoulder injuries and the care you provide for them.
So I provide a whole range of options for shoulder injuries. Everything for conservative treatment of shoulder sprains and strains to treatment of rotator cuff tears, treatment of shoulder dislocations, which are especially common in teens and young adults, all the way up until shoulder replacement surgery for when people are older and they have a lot of wear and tear on the shoulder. Some of the newer treatments about the shoulder have been something that's called a superior capsular reconstruction. It was first started in Japan and it's made its way over to the United States in the last 5 to 10 years. Here we use a cadaver tissue to essentially make a new capsule or as a replacement for someone's rotator cuff that's been torn for an extended period of time. Once it's torn for an extended period of time, it's hard to put it back to where it first belonged. And a surgery like this has allowed patients to get back a lot more function of their shoulder and markedly decreased pain of the shoulder as well. And this is an arthroscopic treatment, so smaller incisions, smaller camera operations, in order to restore function for people who previously either had no options or the option of a joint replacement.
That's an amazing option as well. What are some of the we have a little bit more time, so what are some of the options available today from for the treatment of arthritis, and then when should someone seek out a doctor if they're having arthritic issues?
So I think it's important to hear all the options very early in the arthritis process. Usually it takes months to years for a diagnosis to have something done surgically. So there's plenty of things that we can do in the meantime. I was just working on a presentation on this about knee arthritis and other options that people have. Because everyone thinks knee arthritis, you get a knee replacement. That's the smaller amount of people, though it is becoming a very common procedure as our techniques get better and patients are doing better with it. At first, we start with simple things like just taking over-the-counter medicines. Braces can be very helpful. Even some physical therapy techniques in order to increase strength about the knee can take a lot of pressure off. Weight loss is always important because the more weight that we put on the joint, the more stress it sees and the more pain that people generally have. There are also injections that we have. Everyone knows about cortisone shots, and that's still the most common injection that we give. There have been newer options in terms of gel shots or hyaluronic acid injections, or people also know them as lubricome injections. It's more of a lubricant that's injected into the knee, and people have done very well with that. Finally, there's some newer options, including PRP or platelet-rich plasma, which is the patient's own blood, which is taken at the time, spun down in a centrifuge, and we take a small portion of it with healing factors and inject it back into the knee. There's been some early evidence that we can even not fully reverse some of the damage, but maybe reverse a couple of years worth of damage in someone's knee with that. There's also some arthroscopic issues or arthroscopic surgeries that we can use to clean up someone's knee or clean up a meniscal tear, and some newer operations to deal with inflammation within the bone itself that people do get from arthritis. There's a subchondroplasty procedure, which is an injection of cement in order to shore up a bone. And there's a newer operation out there called intraosseous bioplasty, which is an injection of healing growth factors from the patient's own blood and bone marrow in order to stimulate healing of some of these lesions, which are extremely, extremely painful for people. And
Well, I
really, it's
think
when
that
all that we talk about knee replacement surgery.
Well, I think the thing to take away from today and wrap up is, yeah, there's a if you have an ailment, Dr. Michael Kenya probably has the treatment. So definitely go and see him. I want to thank you for this time, Dr. Kenya. Again, it's drmichaelkenya.com is the website. Thanks again for joining us.
Thank you, David.
and we'll see you next time on the editor's
Okay.
desk.